Good afternoon. Thank you for joining us today. This is our annual Spring Medicaid Fair. My name is Albrian Woods Hawkins. I'm one of the CVO field reps that represents the Northern Territories of the state. Also, Darlene Bonner is here. She represents the South Territories of the state. So we thank you so much for joining. We're going to talk about revalidation and change of information today. Okay, so for starters, to access the presentation, please visit, mmis.georgia.gov under provider information, provider notices. You will see Spring Medicaid Fair, revalidation, change of information presentation, March 2024. All right, our agenda for today is revalidation. We'll discuss where to go to view screen-by-screen guides on how to recredential and revalidate. Recredential, revalidate application common denials. We'll discuss application fee waiver process, what documents are needed. We'll discuss change of information, where to go to view the screen-by-screen guide on how to complete the online change of information form, what can be updated via the COI form versus the demographic maintenance panel. And we'll discuss common change of information returns to provider reasons. Georgia Medicaid revalidation. Revalidation, in April of 2014, the Department of Community Health implemented two requirements of the ACA, which is the Affordable Care Act, revalidation of enrollment and application fees. Revalidation is applicable to all providers at all service locations. That means wherever you're rendering your services, revalidation is needed. Application fees impact only certain facility types, not individual practitioners. The list of facilities that need to pay the application fee are listed in Part 1 of the Policy Manual, Section 105.3 of the manuals that's listed on our web portal. The following are exempt for application fees. For example, individual physicians or non-physician practitioners, providers who are enrolled in either of the following, the Title 19 of the Act or another state Medicaid plan, or providers that have paid the application fee to A, a Medicare contractor, or B, another state. So if you provide, these are the exemptions for providers that does not have to pay the fee. Revalidation notices are emailed to the service location, email address 6 months prior to the revalidation date. So they'll start sending out notices that it's time for you to revalidate. A list of providers who have failed to revalidate is on the MMIS web portal. Under the Provider Information Reports for Public Access tab, the list is entitled Provider Revalidation Past Due. So please check that to see if you are on that list. Okay, how to complete revalidation. So you must log into the secure web portal with your username and password if your provider does not already have one. Once logged into a secure web portal account, please go to your provider revalidation page under your provider's menu option. Enter the provider's identifying information to access the correct enrollment. So make sure you're revalidating the correct provider. Complete the revalidation panels. So for access to the provider revalidation step-by-step, instructional is on the YouTube video. You can visit that in GAMIS under the provider information, provider notices, presentation that states provider revalidation process for August of 23. Any provider who failed to revalidate is subject to suspension. The suspension will apply to providers enrolled in traditional fee-for-service Medicaid and Peach Care for Kids and Georgia Families and Georgia Families 360. That's managed care programs, which are currently administered by Peach State Health Plan, CareSource, and AmeriGroup, which are our CMOs. Claims for services to members enrolled in traditional fee-for-service Medicaid, Peach Care for Kids, the Georgia Families, and Georgia Families 360 managed care programs that do not revalidate will not be reimbursed. So it's very important that you get this done. Upon successfully revalidating, your suspension will be lifted. However, your effective date will be the date that you revalidated. Retro enrollment is not applicable in this instance. Again, retro is not applicable. Should you fail to revalidate your enrollment within 30 days of receipt of the suspension letter, you will receive a notice of termination from DCH. The notice of termination will outline your appeal rights. So we're going to discuss provider demographic maintenance versus Medicaid's change of information form. So the provider demographic maintenance, these are some changes that can be made that you can do yourself, that you don't have to log in to do a change of information form. You can update your taxonomies, your service languages, your mail to values, your address, with your city, state, and zip, email address, website address, phone, fax, after hours phone, and handicap accessible. Service location values, meaning the phone, fax, after hours phone, handicap accessible, email address, and website address. Pay to values for phone, fax, after hours phone, handicap accessible, email address, and website address. Manage and update owner and managing information. So all of the different things that you need to update in your demographic maintenance can be done here. The provider change of information form. So this is what changes can be made via the change of information form. This is what it looks like when you log into your provider file and you click on the provider panel and there's a drop down that says change of information. This just shows you the different types, contracts that you can deactivation participation, reactivation, retro enrollment. These are the requests that can be done. EFT, tax ID, payee affiliation, and payee name. Accessing provider demographic maintenance and Medicaid change of information form. So again, logging into the secure web portal, you log into the web portal in GAMIS, click the login button with your username and password. You will select web portal. Note, if acting as a billing agent, please select the appropriate provider ID from the switch provider panel to begin navigating on behalf of that particular provider. So make sure you're accessing the correct provider. Select the Providers tab. And then here is demographic maintenance. And then at the bottom is change of information. And then you would select change of information, request. Select your requested change. Again, these are your choices. Enter the effective date for the change. And we do not future date. So make sure it's not a future date. You would hit next. Complete all necessary fields and make sure to submit your change of information. So make sure that it's submitted. You have to include the required documents per your request, and it'll give you a listing of what's required. All right, so this is the contact us if you need help, have questions, wondering who to call, who is your field rep. So provider contact services, the number is 1-800-766-4456. We're open from 7 a.m. to 7 p.m. Eastern Time, Monday through Thursday, except for state holidays. The IVRS and GAMIS website are available 24/7. IVRS overview allows users to call and conduct inquiries or transactions on the Georgia Medicaid system. Member eligibility is option 1, claim status, prior authorization, option 6. These are all of your options where you can choose to navigate the IVRS system. Contacting your provider relations field rep, visit our website. These are our Georgia field territories. And here's a listing of the representatives. Contact my provider rep directly. Contact us. You have to be, after logging into GAMIS, of course, you will select that information, then contact us. Select your item. Try to list as much information as possible when you're listing your information so we can do the research prior to our call to you. And normally we get back to you within 72 business hours. Again, please provide all details pertaining to your issue. This is for claims information like ICN or member ID, but if you have provider enrollment CBO questions, you will list the details of that in this details section. And once your process you have submitted your contact us, you will get a tracking number. Keep that for your tracking purposes, so that you can track your request. All right, and these are our consultants, statewide consultants. All right, so at this time, if there are any questions, the floor is open. She's bringing the mic.
So my question is, how do you ensure you don't generate a new provider ID when you are revalidating or credentialing? Because very often I'm noticing my providers are going in, they're doing it, maybe it's a change of information, or I don't know which one it is that will generate maybe a new ID, and now the CMOs have a couple of different things in their system.
My name is Leslie Austin. I'm Director of Providing Enrollment with DCH. Hello, everyone. You have to choose, can you hear me? Okay, oh Lord. You have to choose the correct, hold on. Thank you. The correct drop down. So when you log in, you choose the applicable provider ID number, click on switch user, go to provider, where is the, I think it's provider enrollment, and you see the different application types. So you have to choose not individual practitioner, but revalidation and recredentialing application.
The other question is, so on the drop down that you had up there before, it said that for demo maintenance, it seemed like it was, you could do the service address, the billing address. But then if it was provider change of information, if you were changing the service address also. So that kind of, I think, got a little confusing.
You can.
That's changing it.
That's a change of information form. So if the provider moved from, if the entire practice moved from one place to another, meaning one location to another, then you can submit the change of information form to update the address. If one provider is leaving your practice to go work for someone else, then you need to terminate that number where he's at now, and the other practice have to submit a new application. What's your confusion? The demo change is only for certain things that are small, like your phone number,
Your email address.
your email address. Right here. It's only small things that don't need documentation to make the update.
Oh, yeah.
The values, like your phone number for your service location, your fax number, your after hours phone, your after hours of, or your hours of operation at your business. But if it's the actual location address, if everyone's moving, then you submit the change of information form. The CMOs receive a daily file of our entire provider file on a daily basis, so they have that information.
I understand. My question was, have you explained that the demographic change versus the change of information with the CMOs? Because they just told our provider that they had to do the demographic change for a change of address of a hospital. And that has sent confusion. Oh, yeah. Oh, yeah. So I'm an
We'll go over
idiot.
that again with them.
Thank you.
to
That's
make
all
sure.
I was asking, because I tell them if I hear it from Leslie that they can forget
Just
whatever they
email me,
heard.
sorry. Just email me. Will be available on the web portal as well, so give that to this presentation to them as well. Any other questions? That's all? That's it? Hello,
I
Shola.
don't even want to.
Shola, are we okay?
Comes to the change of information date, you said no future date is allowed, but does it matter how far back we predated, like
It depends on the change. So what are you trying to change?
so if it is, what is what are you talking? Name change or,
There's no date attached to a name change.
okay,
So once we change it, it's instant. You can see it right then. The only thing that has a date is retro, your effective date, and then the location address and tax ID number has a date.
Exit, yeah.
Mhm.
So the fact that it says what's the effective date seems to suggest, you know,
But you can retro, no.
no, well, not a retro, but maybe I want to make a change for June first.
Well, sometimes you have providers that are gonna, like CHOA, is gonna move into the in
Mhm.
September.
Mm-hmm.
We can't future date. So with you guys, you'll have to do your dates.
10
It
days.
takes 15 business days to process it. So if you're moving in September, I suggest you submit your change of information forms in August. But we'll meet with y'all next month. Any other questions? That's all? Yes, ma'am.
Previously, I was trying to submit a Medicaid number, did a new number for one of our providers, but I found out that she already had one, but it had not been used since 2019. So the trick to this was that I had to find out what was the last payment that she had been paid for 2019. And I'm thinking like, we've switched emails because it went to the old email address, which we did not have anymore. We had a new email address, and fortunately, thankful that I found somebody in the provider. One of the agents told me where to go, which I was glad. And I was able to check with our provider rep, and she found it because she told me that they was possible they could find it far back than what we could do. But I kind of found it like, okay, I don't know how long ago this was, and I don't know if we still have the same thing because the bank had changed. All the information had changed. So I was able to get in contact with someone, my provider rep, and she did let me know what was that last payment. But I was thinking like, if you had to do this on your own, you don't use the same bank anymore, and you've changed banks. But like I said, luckily I was able to find our rep who could give us that information that I was looking for.
So what we trying to, for the,
For the provider, they was telling me that I needed to update this particular provider. But of course, we had not had this provider used in the system since 2019.
so
For
your,
the
your
local,
account was locked out.
yeah, but it was
Oh,
locked,
okay.
it was locked out, but I couldn't get any information
You
because
the
they,
web portal.
yes, on the web
Oh,
portal,
okay.
I didn't have any of the information for that particular, but they told me I had to have the last payment that this provider had gotten, which was in 2019. So, but I did, like I said, fortunately, she did direct me to what you just told me to do, to go to the provider and put the contact information in there. And I did get somebody to call me back. And
You updated her file.
yes, after I got everything
Oh,
taken
okay.
care of, then it was updated.
We do have providers, like when you make any changes, make sure you update your provider's information.
Mm.
We do tell providers that.
Okay, so like I said, most of the time they don't do it. I usually have to update it for them. And because like I said, for that particular location, they did already have, I was trying to get a number because we thought she didn't have a number for that particular location. But then when I put it in, they told me, yes, she does have one. But like I said, when I had to do revalidation for her, because we had an old email address that they were still sending the information
So you
to.
were getting the information.
Exactly, exactly.
So did you change email addresses for all your providers for that particular location?
For that particular location, because she already had that number, just like I said, then I was able to change the email address once I got that information. But I was only told that I could get that information once I knew what was the last payment that
And
had been.
Unfortunately, I can't change that. I can.
That's when I had to go do research for it. I finally got somebody to give me the information, then I was able to change it. So I got my problem solved. Okay.
I'm glad. Thank you.
Question, when we make a change for a provider, will that information go to the CMOs?
It does. They receive our tax.
Okay, so we don't have to go to the CMOs to make any change, name
No,
change.
you don't.
Thank you.
Because our file is the source of truth.
Question, is that only for CBO, non-delegated, that information would need to be passed on to the CMOs?
You're delegated, correct? Don't you
Mhm.
have a spreadsheet where you?
Yeah, we do.
That's totally different. That's a totally
Right.
different conversation.
Okay.
Exactly.
So my real question was, regarding taxonomy numbers, some providers still have student listed on the NIPI site.
You need to go to NPPS first to change it with them,
They do.
and then you update it here.
So we can't, we need to submit the application with an updated taxonomy.
What
You-
is that enrolled? You just
No,
want-
I mean, if they're, we're going to have to enroll them, but it's still showing student. We
Then you
can't
go
use
to
the student.
NPS
Okay,
To update it with them, and then you can, list it on the application.
okay.
With reference to revalidations, what are the chances, because we have multiple providers, multiple service locations that would be revalidating at the same time because of how the enrollments will fall. What are the chances we'd be able to revalidate those service locations at the same time? Instead of,
Not with this system, no.
no.
Mm-mm.
Oh,
Not at this time,
not at this time.
not at this time.
Okay.
Okay, another question. Regarding suspensions, when a provider's account is suspended due to lack of claims activity,
For 12 months?
so it lasts for 12 months, and once we,
No, it's
yeah, 12 months of no claims, right? Mhm, right. And so we reach out and they say, well, yeah, I'm gonna still see patients. So once we request to reactivate it, is there a time frame
30
that they,
days. You have to 30 days.
30 days that they need to
To
submit a claim for services rendered?
Or to resubmit.
Okay.
I got another one on revalidation. I have a change of ownership that Medicare is just hopefully
talked
going to
about it.
acknowledge this week. Should I send them
So
both
the
in?
old owner is gone.
Old owner's gone. I mean,
So
I'm
can
gonna
a
put
new
it
owner submit that, revalidation application, but it's gonna list the old owner's information though.
correct.
So they can go ahead and do it. Do they have access to the file?
That would be me.
Or do you have access to their
I
file?
do have access,
Go ahead and submit it, but it's gonna be on the old owner's tax ID, NPI, everything.
correct.
Mhm.
Okay, but it's $709 to do the the revalidation,
Is it a
right?
hospital?
Yes.
Have they paid it to CMS within the past 5 years?
No. Oh, in the last 5
Yes,
years.
sir.
I'll have to see
Well,
if I
we
can
need
get
to
access.
receive them,
Yeah, I'll have to check on that. But if not,
then we.
I'm going to be refiling, I'm going to be re-enrolling the new hospital at the same point in time.
Under this, you
Mhm.
have to pay it again.
That's what I'm saying. So I can
We
say,
can switch.
same address, it's
We
going
can
to
use that
work.
Same application.
I can
fee
pay it once. I
for
don't
the new
care.
owner.
That'll work.
Mhm.
Thank you.
You're welcome.
Thank you.
You just have to tell us the ATN on company letterhead to say we've already paid the fee.
Can we get a list of all of our providers with the revalidation date? So,
If they pass,
no, they're all current now, but how can I get a list of, I have 7 providers?
you can request. You'll need a tax ID number. And what elements do you want in your spreadsheet? Like provider name, address, revalidation date, recredentialing date, et cetera. You have to list that in the contact us. You're welcome. Are there any other questions? Well, thank you everyone for coming. Enjoy your day. Safe travels. Have a good day.